150 Hamilton County organizations are pushing back against fentanyl.
Investigators say law enforcement is only one piece of the puzzle. WCPO 9 News reporter Madeline Audley has been tracking the unique solutions showing results.
Some focus on breaking down barriers to recovery. Others meet people who use drugs where they are, making it safer for them to do so until they're able to quit. These are the sounds of what's become a bi-weekly ritual for Nick Forrester.
My Narcan is, here it is.
He struggles with addiction, mostly fentanyl and meth. This brown bag filled with tools that help save lives. He's picked up clean needles and Narcan, an overdose reversal medication from outreach workers in Price Hill.
I caught a penitentiary number and I ended up getting addicted to heroin, i.e. fentanyl, whatever, in Ross Correctional.
That was the end of 2014. Within about 2 months, his addiction was full-blown.
I looked myself in the mirror and I was sick and I didn't even know that I was a junkie then.
He'll use about 10 needles a day, but the Narcan isn't really for him.
I haven't overdosed in 5.5 years. But, however, I did just save somebody's life not even last week.
In the last 7 years, he saved more than 20 people, each of them several times.
It happens so often that I no longer panic.
Hamilton County's quick response team distributes supplies like these 5 days a week. They focus on overdose hotspots like Price Hill, Walnut Hills, and Colerain Township.
The general community doesn't agree with it because it feels like we're aiding in their addiction. But the way we see it is harm reduction is reducing the harm that the clients are experiencing while they're stuck in the cycle of addiction.
The strategy's been around for decades, and it's got a broad reach.
Overall, 11 of which are in treatment and/or recovery.
This QRT program is more targeted.
He said he met one friend at Brightview.
You're watching a coalition of police officers and addiction response workers swapping updates on drug users at the highest risk to overdose.
She kicked daughter out and daughter's boyfriend because they are in active addiction now.
They know each by name. It's part of a pilot program based primarily in Price Hill. They've identified high-risk users and wrapped services around them.
The longer you build those relationships, the more they trust you.
Sarah Coyne is one of the peer navigators.
All right, so we'll just call, do the phone screen.
Each week, she visits clients in the program. Then she's there as soon as they're ready for treatment.
How well do you get to know these people?
Really well. Really, really well.
According to the county, the pilot's first wave included 14 people who collectively made up almost 25% of overdose calls in CPD District 3. By the end of it, the county says overdoses among that group were cut in half. For Coyne, it's personal. She struggled with addiction for about 6 years.
Long enough to ruin my life multiple times. Alcohol was the primary, but I used a lot of everything.
Then she got pregnant, and that changed everything.
All I've ever wanted to do was be a mom. I told my mom, like, I can't mess this up.
Now she's helping others find their reason to quit.
As long as you have drugs, you're always going to have people that deal with addiction.
We don't want to kill ourselves and we don't want to kill other people. It's just addiction, and I'm sorry that it fell to the ones that it has. I mean, I'm stuck in this cycle and I feel like it's forever.
In Price Hill, Madeline Audley, WCPO 9 News.